Thank you very much, Siobhan. Good evening, everybody. Unlike Michael, I have to write my own speeches. I immediately accepted when Barbara asked me if I would be willing to speak to you this evening. I'm always very willing to help the foundation because of their tremendous work. And the foundation, and by extension, you, the donors, have been absolutely essential to the functioning of our hospital and to the delivery of healthcare on the peninsula. Barbara asked me if I could comment on the impact of new operating rooms from a surgeon's perspective. And I've been a surgeon now for a long time. I worked at Peace Arch for 15 years. And before that, I worked at Richmond Hospital for 10 years. And so I guess one word for me is experienced. There's others. More recently, I've actually worked at Jim Pattison Surgical Daycare treating kidney stones. And so I've also seen sort of current state-of-the-art facilities and the impact that they can have. So new operating rooms at Peace Arch have been talked about for a long time. Dr. John Kant, my predecessor, was lured out to practice here from Ontario, and he came and practiced for 14 years, and he was lured out with the promise of new operating rooms. He retired. I've been working in his job for another 15 years, and so we've been talking about new operating rooms for 3 decades. It's a good thing that us surgeons are good at surgery because we're not very good at administration. We've talked and talked for years about new ORs, but really we've got nowhere. And it wasn't, there's going to be a theme here. It wasn't until the foundation had the idea of funding an official hospital plan process that the idea really got off the ground. And so it was considerable foresight and effort combined with an understanding of how healthcare planning processes work. And all that came from the foundation. I think, I thought it might have been Art. Somebody, yeah, was that Art? Yeah, Art. Art did that. So as a result of that, we had an official plan, and that eventually this is becoming a reality. And so now we are very excited that we have new operating rooms that are in the works. There is a lovely brochure. I think they call them surgical suites in here. I've been using the word operating room for like 30 years, and I think I'll have to stick with it. And so now onto my topic, like what are the benefits from a surgeon's perspective about these new surgical suites? Well, probably the first thing is space. So we were cramped. These operating rooms were built in the 60s. They're 5 decades old. And our current rooms are about a third smaller than the current minimum recommended size. And we squeeze things into operating rooms that never were even imagined in the 1960s. So we've got laparoscopic imaging towers, we've got fluoroscopic imaging towers, we have 2 laser systems, we have operating microscopes, video intubation systems, orthopedic tables, patient warming machines, electrosurgical units, and so we're literally bursting at the seams with our current footprint. The equipment undergoes wear and tear because we have to move it around. Our lasers are very, very delicate instruments. They cost about the same amount of money as a Ferrari, and there's a bunch of delicate mirrors, and you don't want to knock those things out of alignment. So things have been constantly moved from one location to another. Studies have also shown that if medical staff and including the nurses and the anesthetists worked in cramped spaces, it just increases stress. The second reason is technology. So we have currently a very old climate control system which is ready to retire. New operating rooms come with modern HVAC systems with laminar airflow that help contain hazardous materials and reduce risks of infection and contamination. Modern operating suites have ceiling-mounted video systems and imaging systems. So lots of times when you operate, you've got laparoscopic equipment and you've got a number of screens showing you what's going on, and you also have imaging equipment. So currently we have towers that are on wheels, and they have a a physical footprint on the floor of the OR. So in Jimmy Pattison, everything is suspended from the ceiling, so there's a lot more room for the staff to move around. The other thing that's in the design is very important is they have just more space for private consultations with patients before they go into the OR, and for anesthetists to treat patients with blocks if they need that. Finally, in this plan, the whole delivery of surgical care will be done on one level. Patients will be seen in a preoperative area and then go to the OR, and they have the postoperative recovery room, and then finally the discharge space is all on the same level. So that will help us a lot, because currently they're up and down the elevator all day. So the foundation has created this great booklet, and it outlines the differences between what we have now and the proposed new suites, and it mentions lots of things that I haven't talked about. So most people can understand the changes that affect the physical plant of the OR, but there's another very important effect that's going to come from this change. And these new operating rooms will have a profound effect on all of the surgical staff. So I don't know if everybody realizes, but the number of surgeons and anesthetists and nurses has always been proportional to the number of operating rooms, and they're limited by the number of operating rooms. And whether those are ORs that are physically present or ORs that are funded. So the problem is that our hospital at PSARG, we've been at capacity for many years. In other words, we run our rooms full all the time, and that's limited our ability to increase and expand surgical services. And so surgeons need time to operate as part of their practice. And if the ORs are full, we can't add more surgeons. And so, as you're probably aware, that the population on the peninsula has doubled since I moved here 20 years ago. And from what I can see, plans to add density aren't going to change. And so with the new ORs, it also comes with our ability to expand our footprint. And so we're planning for 5 operating suites, and we will convert one of our rooms to perform cataract surgery. So I've heard, I asked Michael this at dinner, I've personally heard Michael say that he's not going to build ORs and have them sit empty. Is that true, Michael? So the implication is that our expanded number of operating rooms will also come with an increase in operating dollars, and this would be welcomed by all of our staff. And so what I wanted to explain to people is that the quality for OR staff is largely determined by on-call. And when you're on call, it means that you have to be available at any time of the day or night to assess a sick patient and to operate on them if they need surgery. And on-call usually lasts 24 hours, and on the weekends, you're on all weekend long. And so the larger the group of surgeons in each specialty, the less negative impact of these on-call obligations. So for example, if there's 3 general surgeons, you do 1 in 3 call. If there's 4, you do 1 in 4. And so the Canadian standard is to have people work on 1 in 5 call, because they figure that that's the sustainable level. None of our specialty groups has 5 surgeons yet, but the busy ones are getting close. And there's always been a goal with Fraser Health Administration of making call groups large enough so that they are sustainable. And so there are other advantages of increasing the number of surgeons in a given specialty other than frequency of call. This would allow some subspecialization in the area. And so, for example, in orthopedic surgery, all of them do standard joint replacements of the hip and knee, but this would allow people to subspecialize in upper extremity or sports medicine or something like that. And with larger numbers of surgical staff, you also have greater turnover. And so when young department members come, they often bring subspecialized techniques that we can bring to our local population. And so there's lots of examples of this. We did create space in my own specialty, urologic surgery, and we were able to attract Dr. Herman Kwan, my partner. Again, the foundation was instrumental in this, and so was Fraser Health, because they provided the operating dollars. The foundation provided the money for laparoscopic equipment, and as a result, we now have laparoscopic kidney surgery and intrarenal laser surgery for kidney stones that we'd never had before. And that's because this young person brought these subspecialized techniques to our hospital. So the trend of subspecialization in surgery is definitely going to continue for sure. Another important advantage of expansion would be to increase the number of anesthetists at Peace Arch Hospital. They have a very considerable on-call burden, largely from obstetrics. That's kind of what gets you up between midnight and 6 in the morning. We have a big obstetrical load. We've got the obstetrical load of a 5 OR hospital, and we have the manpower of a 3 OR hospital. So our anesthetists do a tremendous job shouldering this increased burden every single day, 24/7, 365 days a year. An expansion of our OR operating room footprint would bring more anesthesia staff and much needed relief for that. And similarly, OR nurses, the same thing. They have the same on-call burden as anesthetists, and with more operating rooms, they'd have an ability to hire more nurses, and the on-call burden per nurse goes down. So many nurses, there's currently quite a crisis in OR nurses in at least Western Canada. Many nurses live locally, but they work at bigger hospitals because their on-call burden is less. And so if we have better working conditions, we will be able to recruit and retrain relatively scarce OR personnel. And so so there's basically huge impact of new operating suites. It's just profound from my perspective. The impact is really twofold. So modern surgical suites would address our cramped quarters and our outdated physical plant and would allow us to deliver state-of-the-art care. And expanding our footprint would allow us to meet the demands of our growing population and improve the working conditions for anesthetists and OR nurses. At present, there's a shortage, and the new suites would make Peace Arch more attractive for these in-demand specialties, and that would help us, and it would help us a lot. Thank you.